This is a health education project on depression, presented by Vanessa A. Kenny from Indiana State University Community Health Nursing. For this presentation, the population at risk will include military soldiers pre-deployment and post-deployment. Objectives include describing signs and symptoms of depression, identifying risk factors for depression in soldiers, review of the Hamilton Depression Rating Scale, review of Beck's Depression Inventory Screening, differentiate the degrees of depression based on scores of the Hamilton Depression Rating Scale or the Beck's Depression Inventory Screening, and identify treatment options available for depression, including pharmacological and psychotherapy sessions. At this time, please pause this presentation and complete the pretest. The pretest is a 10-question survey to determine your current knowledge regarding depression. Once completed, please resume this video for remainder of health education project. We're going to start with the definition of depression. Depression is the negative thoughts or feelings that affects one's life. Depression can cause psychological, emotional, or physical distress. We're going to review the history of depression. Depression dates back to when depression was considered a time of evil spirit taking over the body, and treatment was provided by priests only. It was first classified as a mental condition rather than a physical condition. Therefore, physicians did not care for patients with that diagnosis of depression. In the 5th century, depression was treated with gymnastics, massage, special diets, music, bath, and poppy extract with donkey's milk. Hippocrates believed depression was related to color and type of bodily fluids, including bile, phlegm, and blood. The Romans felt depression should be treated with starvation, isolation, shackles, and physical punishments. Eventually, depression became a sign of infection, and contact with a depressed person could transmit to an uninfected person. Treatment of transferred depression illness involved removing and/or destroying demons by use of exorcism, drowning, or burning. Additionally, infected people were placed in mental institutes such as asylums. In the European 14th century, physicians reviewed Hippocrates' hypothesis of natural causes creating depression in otherwise healthy people, and that most people in need of medical attention were the witches who suggested depression was caused by evil spirits. In 1691, depression treatments were suggested to include happier thoughts and actions, including body cleanses, marriage, vacations, exercise, and more. During the beginning of the Age of Enlightenment, or the 18th and early 19th century, it was thought that depression was inherited, unchangeable weakness of temperament, which could lead to the common thought that affected people should be shunned or locked up. As a result, many people with mental illnesses became poor and homeless, and were often committed to institutions for mental disease. Signs and symptoms associated with depression include sadness, anhedonia or loss of interest, dietary changes, changes in sleeping pattern, fatigue, delayed actions or responses, low self-esteem, indecisiveness, and suicidal ideations. The signs and symptoms associated with depression can vary from person to person based on the degree of depression and the impact it has on that person's life. Therefore, depression may be difficult to diagnose or observe. Signs and symptoms of depression in soldiers' families. Spouses also suffer from depression, resulting in fear and anxiety regarding military status or deployment. Children often suffer from depression, anxiety, and behavioral problems associated with deployment or parental loss from a deployment. Symptoms present in children include separation anxiety, behavioral outbursts, educational struggles, anger, frustration, isolation, eating or sleeping pattern changes. Risk factors for depression include stress, both inward and outwardly influences, financial struggles, emotional turmoil, failed societal expectations, and military deployment. Depression is the most common mental condition affecting people at any point in their lives. 14% of soldiers report depression after deployment, and 19% of soldiers report depression after combat deployment, resulting in traumatic brain injuries. These numbers may be higher due to the lack of reporting or seeking medical assistance. Deployments not only affect soldiers, but their entire family as well. These were reports documented by LEG in 2016. We're going to look at the two tools currently used in depression screening for active military soldiers. We're going to review the Hamilton Depression Rating Scale and the Beck's Depression Inventory. The Hamilton Depression Rating Scale focuses on the best description of the emotional state based on 17 questions from the last 7 days. Questions range from diet, sleep, exercise, and self-reflection. Scores of the Hamilton Depression Rating Scale range from normal to very severely depressed. Whereas the Beck's Depression Inventory assesses the degree of functional disturbance based on 21 questions, ranging from no disturbance to complete impairment. So the score results are from 1 to 63, and the level of depression is diagnosed based on the score. Treatment options for depression include medication, psychotherapy, a range of individual, group, or family meetings, relaxation regimens, changes in nutritional diet, and regular exercise. Without treatment for depression, more than half of the military soldiers are more likely to commit suicide or commit domestic violence as a means of coping with depression. Additionally, the physical and emotional detachment with a soldier's loved ones affects the entire family dynamic. Unfortunately, divorce is not uncommon. Seeking help for depression takes baby steps. Steps for seeking help include having patience. Depression cannot be fixed overnight, as most likely it took much longer for the signs and symptoms of depression to develop. Seek counseling from friends, family, and medical professionals. Social interactions are encouraged to prevent isolation. Avoiding recreational activities such as drugs and alcohol, and attending support groups as counseling and to gain understanding of depression and the resources available right in your own community. At this time, please pause the presentation again and complete the post-test. The post-test is the same 10-question survey as the pre-test and will evaluate your previous knowledge with the new information presented during this educational presentation. Once completed, please review the health education handout in the link provided below. Thank you for watching, and I hope you learned more about depression in soldiers.